Hey, it's Julie Tristan. Welcome to Healthful Conversations with SSM Health. I'm so excited to be talking to a pediatrician today because we need to chat about school physicals and pediatric wellness. So I have Dr. Keith Mall, pediatrician with SSM Health Medical Group. Hello, Dr. Keith Mall.
Hi.
Why is it important for your child to receive their back to school physical from their pediatrician versus somewhere else?
Yes, we do. I think, I as a pediatrician or as even a parent looking at that, I would say, okay, there's a convenience factor, but there's a lot of other issues that go into that. For myself, usually if we're there for a physical, if I have a child for a physical, I'm looking at past history. I'm looking at any concerns we had in the past. Reviewing medications, a lot of actually behind the scenes kind of things going on there, which I'm, thinking probably doesn't take place if you just go to the Walgreens or urgent care to have your physical done. They'll check your heart and things, sure, of course, but there's a lot of other things that actually should take place that we do on our well checkups.
Can your child's well visit and school physical be done in tandem during the same visit?
The way we do this, yes, the answer is yes. They're both kind of done together. But just think of it more of a well child checkup is a little more extensive. We do the physical part, yes, but we delve into a couple other things, maybe on the well child checkup, like are you growing well, gaining weight appropriately? Again, talk about any other concerns that might be happening at the time or previously. There are still issues that are out there that are important to your child's overall health and well-being.
So, as a physician, what are the most important things you're looking for during a child's well visit?
It would be things like have we had normal growth? Have we had normal weight gain? Another big one is development, particularly in the younger children. We go through the developmental sequences more frequently. Are they hitting other milestones? The older children, um, it we touch on how well the school year went for them. Of course, this year would be a little different, this past year, a little different than other school years, maybe for them. I personally ask, how did the school year actually happen for you? Was it home? Was it in person? Was it virtual? Just to get a feel for what occurred, how it occurred, and how well they think they did during the school year. And then a lot of times I think with well checkups, it allows an opportunity for the patient or parents to ask those other questions that kind of they've been thinking about, but just never asked or weren't sure was it really a concern to maybe approach that and have that discussion with their doctor.
What do parents need to know when it comes to vaccinating their kids? This is a really important question right now.
Yes, it is. It is. Um, I think if there are concerns and you know your child's due for vaccinations, present those concerns. Um, yeah, a lot of times, what we find is that there's some misconceptions with immunizations, like things that are um, parents read a lot. There's a lot of information out there. Some of it is accurate, some of it is not so accurate. But it gets started, and then you wonder, and you're concerned. I'd say always bring those concerns up, but it is important to get the immunizations because essentially the way to think about this is the immunizations are protecting you and others from these particular illnesses, from getting them, but also spreading them. There and that's with every single immunization you want to talk about. It's always protecting the individual, but that also protects the others around them. Not only the ones in close proximity, but the ones they come in contact with. The ones they come in contact with daycare, the one they come in contact with at school, the ones they come in contact with their sports participation and things like that. You just come in contact with a lot of individuals at times, and just think about spread of illness, how we could help that, prevent that. Yes, that's what to think about with the immunizations.
Perfect. Well, thank you so much for your time today. Thanks for all this great info. Dr. Keith Mall, pediatrician with SSM Health Medical Group. Thanks for being here today.
Thank you. You're welcome.
This has been Healthful Conversations with SSM Health. You can find out more at ssmhealth.com.